Hi, I'm Ed Israelski, one of the co-directors, co-chairpersons of the Human Factors Engineering Committee of AAMI. Human Factors Engineering is applying data about human capabilities and limitations in the design of medical devices and using data about human behavior that's been collected from applied psychology. And so our committee takes this data. We have professionals on the committee who are human factors trained, takes this information and creates standards around the correct application of human factors engineering, the process to the development of medical devices, as well as we have developed standards recently, HE75, where it compiles information from the human factors literature to give advice to medical device developers on the best way to accommodate humans as users of their devices to make them effective, efficient. In the last 2 days, the committee has met and we discussed a number of new work items. One of the larger one there is a rewrite of an AAMI standard that was adopted from IEC called IEC 62366. We believe with changes in regulatory environment, new thinking about human factors, methods, and techniques, that we should update the standard. So we had a lot of discussion about the nature of that update and an agreement on a work plan to move forward to provide outline and then a working draft of a rewrite of this international standard, and we will present that to the international joint working group responsible for that standard. Second, we examined a couple of new work items regarding human factors engineering applied to healthcare information systems. So we have an outline there of a new work proposal that we will be submitting to produce a standard or a TIR addressing that area of healthcare information technology. Another new work proposal is to develop a TIR or a standard on analysis of use error complaints and medical device reports to help manufacturers use this data appropriately to redesign devices, to help their complaint handling people better receive information about complaints with medical devices. So that's a big effort. Another one that we're looking toward is an outline of a standard or technical information report, again, that would address contextual inquiry. This is one of the methods of human factors where you study the users up front and understand the tasks they're going to do, the use environment, and the profiles of these users. And we think it would be appropriate to have a guidance a standard in this area that would help manufacturers understand the best practice ways of conducting this contextual inquiry or upfront user research, which is a foundation part of human factors.